There are two terms that should not be confused. There are different fasting blood glucose levels expected in a non-diabetic and in a diabetic patient. Also, there are different values of blood glucose that are accepted as normal 2 hours after eating food in non-diabetic and diabetic people. So let's talk about non-diabetics first. In a non-diabetic individual, the normal fasting blood glucose reading is below 100 milligram percent. That's normal. So anything between 70 and 99 is normal. If the same person eats then 2 hours after eating, the value should not be above 120 milligram percent. It should be below 120 milligram percent. That's in a non-diabetic person. Compare this to a diabetic person. In a diabetic person who is already been diagnosed with diabetes and who is under treatment for diabetes, the normal blood glucose reading is below 120 milligram percent. That fasting sugar in a diabetic patient should be below 120 milligram percent. 2 hours after eating food, the sugar or glucose reading in a diabetic should be below 140 milligram percent. So it's different from those who are non-diabetics. So if you are a diabetic, your fasting blood glucose should be below 120 milligram percent, and 2 hours after eating food it should be below 140 milligram percent. That is ideal. If it is significantly higher than that, then you need to see when it is high, and we talked about 8 tests in a day to see when it is high, and then work with your doctor and your dietitian or your nutritionist to see how it can be managed to bring it down to the values I just mentioned. If it is slightly high, it can very easily be managed by managing what you eat. And we talked about before and after food difference, that if it is high before food, probably there is a need to readjust your medication. If it is high after food, probably there is more need of adjusting your diet and the way you eat what you eat. So we talked about how glucose is formed in the body, why it is needed, what are the normal values, and what to do if they are high. We will talk about symptoms of low blood sugar and high blood sugar in a different presentation when we are talking about symptoms of diabetes. So we talked about normal glucose values. Now let's see what happens if the glucose goes high. Till it reaches 180 milligram percent, our body can still conserve it, can still hold it. Once it crosses 180 milligram percent, it is spilled over in the urine, and because it cannot pass as powder, it takes away with it a lot of water. And we will talk about these symptoms of high sugar when we are talking about symptoms of diabetes. Here is just a summary. So since the glucose above 180 milligram percent cannot be kept within the body by the kidneys, it spills over, takes a lot of water with it, causes dehydration, and dehydration can cause dizziness and also leads to a lot of thirst in the patient. So the patient drinks a lot of water. So excessive urination, excessive thirst are important symptoms of diabetes or high blood sugar. Also, because the glucose is high, it can lead to more chances of infections in different parts of the bodies, including the lungs, in the urine, in the vaginal area in women. So those are some other symptoms of high sugar. High sugars can also interfere with normal vision, normal healing. In the eye there is a structure called lens. It swells up when the sugars are high, and then it's like a grape in the very syrupy solution. So it changes its focus when the sugars are very high. So there's decreased vision, difficulty seeing, there is difficulty healing of smallest of wounds, and if the lady is pregnant, then there can be heavier baby. So all those are symptoms because of high blood sugar values. Now what happens when the sugars are low? For any reason, and this happens especially when somebody is being treated for diabetes, that's the commonest cause. It can happen without being treated for diabetes also in a rare condition, or say for example when somebody is fasting for a long time. But in reference to diabetes, if somebody is taking medication to bring the sugars down and the sugars go lower than they should be, normal value is up to 70 to 99 milligram percent. So if the sugar goes down to 50 or 60 or 40, some symptoms will happen. And what are those symptoms? And these symptoms are, the person feels hungry. That's the function of the brain. If the sugars go down, it should feel the patient should feel hungry. So the patient feels hungry, patient feels dizzy, patient feels palpitation, patient feels emptiness in the upper part of the stomach, hunger contractions, like the patient is really hungry. Patient can sweat. So headache, sweating, feeling hungry, feeling dizzy, feeling like hunger pains in the upper part of abdomen, inability to focus because the brain is not getting glucose, inability to concentrate, confusion, irritability, seizures, unconsciousness, they all can come from low blood sugar, and we will talk about those in detail in our presentation on low blood sugars, how to identify and correct them in the right way. So by now we talked about A1C values in the first part of the presentation. Then we saw the A1C values depend on the blood glucose values, and we saw how normal blood glucose values are derived, how normal blood glucose values are maintained, and then what happens if the values are high or low.